Hello, welcome to the monothematic conference, Liver Fibrosis, the Next Goal to Therapy. This monothematic conference took place in Porto, the 17th and 18th of June. And it was a very exciting meeting that gathered almost 200 people coming from different countries. You can see all the speaker interventions in the liver tree, so please don't hesitate to go to the liver tree. My name is Sophie Lotersztajn. I am from Paris, the Center for Research on Inflammation, which is an INSERM center, and I co-chaired this meeting with two nice men. Christian, please introduce yourself.
So my name is Christian Trautwein, and I'm coming from Aachen in Germany, and I'm the head of gastroenterology and hepatology in Aachen. And we have a big program, an SFP, TR 57, who is concentrated on fibrosis in the liver, but also in the kidney. So we are looking on specific aspects of liver fibrosis in different organs.
Massimo Pinzani, I'm Professor of Medicine at University College London and Sheila Shello Chair for Hepatology at the Royal Free Hospital. And I have been working for many years on liver fibrosis, so this was a meeting of my particular interest.
Christian, what were the important things that you noticed during this meeting?
So I think we have to really focus on different aspects which were relevant for this meeting, and each of us will a little bit tell about the topics which we found were very relevant. And I would like to start with the factors which are relevant as sort of predisposition. So what are the mechanisms at baseline which may lead to a stronger liver fibrosis in specific patients? So we had different aspects on that, and one talk which was very interesting was indicating, for example, mutations in the genome which are relevant. For example, a mutation PNPA3, which obviously changes fat metabolism in hepatocytes, but interestingly also in adipose tissue and also in hepatic stellate cells. So I think this is a very important mutation, and other mutations are around which are relevant either in mechanisms of inflammation, but also in mechanisms of fibrosis progression. So this was one of the first aspects of important mechanisms. The second, I think, was very interesting was the microbiome. So obviously the microbiome is very important for the interaction with the immune system and also with translocation of bacterial products into the liver. So these two factors, the genome changes and the microbiome changes, seem to be very relevant for the progression of liver diseases.
Okay, Massimo? What is your feeling?
Well, I mean, the feeling is that in this conference, as in many other occasions before this conference, there is an urgent need to make a precise plan how to translate the huge amount of basic information that have been achieved in the last 20 years into something that can finally go into patient care. So during this meeting, there was a particular attention on two aspects. One was an appraisal of the performance of the different animal models. And although there is not yet a consensus on how many animal models should be used to test, for example, an antifibrotic drug, or the number of animals that you need to use for each experimental condition, but it was pretty clear that there are some animal models are important for verifying some basic mechanisms, and some other models are very important to make a bridge, and translating the finding to human disease. Although this is very difficult because there is not a single animal model that has, that recapitulate completely the human pathology, with the exception of an increasingly increasing improvement in the model for non-alcoholic steatohepatitis or metabolic liver disease, which are becoming slowly more and more accurate. In addition, there was a very nice presentation and a very nice appraisal also on the difference between the standard in vitro model based on culture on a two-dimensional plastic surface in comparison to the newly introduced and the increasing number of introduced models that see the culture done in a three-dimensional model. And the speaker actually addressed different type of materials, from synthetic materials to material derived from discarded human organs. And definitely there will be improvement in the quality of the targets by using this type of methodology. That can also be used for disease modeling and also to test drug toxicity and drug efficacy once we have a compound that can be proposed as antifibrotic. So probably the transition from early discovery of targets into human trials will take advantage of these improvements.
Okay, so to go on with what you are saying, Massimo, although we don't have a perfect model of perfect animal model of liver fibrosis, and this was really discussed, we need to perform experiments with the models which are available, and this has been useful for translational studies and to go into clinical trials. And regarding the basic mechanisms that were discussed during these meetings, we had 2 talks on epigenetic regulation of liver fibrosis and the role, for example, of deubiquitinase in liver fibrosis, with the demonstration that inhibition of a deubiquitinase may be an interesting target. Interestingly, and this is really a growing field in the liver fibrosis field, there has been a focus on immune regulation of liver fibrosis. And we know for several years that macrophages are important in the progression and the regression of fibrosis. And this is still true, and the targeting of these macrophages is very important. The things that were evoked during this meeting is that also cells from the adaptive immune system and cells which are at the interface between innate and adaptive immune system, the innate lymphoid cells, are new targets in liver fibrosis. Of course, we need to translate this to the human situation. And also we need now, we are in the middle of the bridge, because we have description of the role of each type of cells in liver fibrosis. What we need to do now is to find a way to study the relative contribution of all these immune cells in the regulation of fibrosis. And I think maybe, Christian, you want to comment on the first trial regarding the CCR2, CCR5 antagonist, which is a good example of how the basic science study on the immune regulation of fibrosis can be translated to a clinical trial.
I think before we do that, I think what is very important, and was for me also a very interesting aspect in this meeting, is how to monitor trials. Absolutely. And how to monitor liver disease progression. And I think here we had very, very interesting aspects where we are on the way on the liquid biopsy also in liver fibrosis. So obviously we have now new markers which can be found in the blood. For example, we have new indications that, for example, free DNA could be an important aspect. Additionally, the big data now are collecting all the potential markers, which together, maybe 4 or 5 markers, will be the way to liquid biopsy to understand, first of all, if a disease is on progression or regression. But even more important, if we have potential markers doing disease progression and doing therapy. So I think this will be very important to have liquid markers, liquid biopsies from blood. This was the first aspect. The second aspect, which was very challenging, was that in imaging techniques, we have meanwhile very specific probes, for example, for collagen or for HSCs, where we now can do imaging mechanisms by MRI, which are really interesting. And right now it's still in animal models, but however, I think in the future, these probes will be very useful also for humans. So we really can monitor disease progression and regression during therapy, but also on the normal life situation. And this will be a very important aspect to bring new clinical trials and to really have not only biopsy-driven clinical trials, but also to have new aspects in this way that you can monitor very good liver fibrosis.
So I think we have completed this debrief. I think we hope it's helpful for the public, and you can go through the session of this meeting, consulting the liver tree, which is there for you to go back anytime you want and think again what has been discussed, and hopefully get good ideas and be a speaker at the next meeting. So EASL also wish to all the people that consult the liver tree to enjoy all EASL educational activity online and live. And thank you for being with us in this occasion.